go. Let's go. Turn up. So, my name is Dr. Asang, cardiologist here in Tennessee, using this opportunity to talk about things regarding the heart health and prevention, specifically chest pain, heart attacks, heart failure. Why is it important? These things, if you can potentially prevent it from happening, it's going to be better for you. You're going to lead to a longer life, a happier life, less expenses in regards to um, the medical bills. What if I want to know more about regarding leg or knee pain? Then you got to go to an orthopedic doctor. I appreciate the time, but I talk about chest pain, cardiac issues, leg pains, knee pains can be orthopedic surgeon. It can be a general practitioner, but uh, that one you need to go to someone who is more well versed in that. So, what I talk about is heart disease, heart failure, heart attacks, hypertension. These are all things that I see on a daily basis. So, when it comes to heart disease, the most important aspect of heart disease is prevention. So, what does that mean? So, the risk factors for heart disease includes things like hypertension, high cholesterol, diabetes, strong family history, smoking. So, if we control these risk factors, we can potentially prevent a heart attack from happening, or for some people, delayed from happening. Instead of them having a heart attack in their 40s, 50s, they can probably delay to their 60s or 70s. Why delay? Because some people have genetic predisposition to having heart disease, specifically people who have a strong family history, people who have genetics that are associated with it, they're likely going to have an event, unfortunately. The good thing is that we have so many more advances that we can prevent that from happening as best as we can. We can reduce that LDL, that bad cholesterol, as well as we can to prevent it. But there's some people who just have really strong genetics that predispose them to having heart disease. So for those individuals, it's important to control other risk factors such as high blood pressure, such as smoking, especially smoking. I feel like a lot of the patients that I see, unfortunately, smoke, and it doesn't just lead to a heart disease. It can lead to peripheral arterial disease, issues with their arteries in their legs, arteries in their necks, that they need to see a vascular surgeon. So the most important thing that I can, tell people is that prevention is a lot cheaper, and it's a lot should be focused more when it comes to heart disease, when it comes to preventing heart attacks. So once again, it is the risk factors includes high blood pressure, high cholesterol, diabetes, smoking, and just not following up with your medical provider. I feel like a lot of people don't see them enough, so they don't know that they have the risk factors. They live with these risk factors for several years, decades, until they finally get into the hospital, and then they say, "Oh no, you know, my uncle, my dad was always sick, and then he had a heart attack." When in reality, he had heart disease for a long time, but it was never checked on. It was never treated, and unfortunately led to his demise. So I'm a cardiologist. I'm a heart doctor. I have my own office. I do my outpatients in my office, and I do inpatients in a hospital. So lost my grandpa to a heart attack. We were too late to admit him to the hospital. And that's the unfortunate truth, that a lot of these things happen at home, and there's not enough, recognition of the signs and the symptoms. And some people, they die in their sleep. So it's very important to know what these risk factors are so that we can treat it appropriately. So what is the chest pain that gets someone who is a cardiologist nervous? So when you have chest pain here, the pain can move to the shoulder, sometimes to the jaw. That gets me nervous. Pain that is worse with exerting yourself, such as walking up a flight of stairs, exercising, that gets me nervous. Pain that gets better with rest or medication called nitroglycerin, um, that gets me nervous. So when people have all of those combined, I definitely want to make sure that their pain is not due to a potential heart attack. So depending on where I'm seeing them, I either have them go to the hospital as soon as possible, or if they're in the hospital, get them to a cardiac catheterization lab to do a cardiac catheterization to look for the blockage. If there's a blockage, we put a stent in. If there's several blockages or blockages in scary locations, we think about open heart surgery or cabbage. So, in regards to heart disease, what questions do you guys have in regards to heart health? What questions do you guys have that I can potentially um, find some assistance to help direct you guys? And Judah Atlas, this is not the place for an answer for that. I would definitely recommend, calling someone to get help to understand everything. Unfortunately, I cannot provide you with an answer for this, but there are many places that can actually get you the help that you deserve, not just that you want, but you absolutely deserve it to voice your concerns and to be able to discuss, you know, what you're feeling and how to help cope and, you know, flourish despite everything that is going on in your life. Not bothering at all. It's good to finally let it loose, but I believe that I'm not trained to be able to give you an answer for that. But I can say that you need to find someone to help, therapist, psychologist, psychiatrist in some circumstances, a close family friend that understands how to approach that question appropriately. Not bothering at all. So, we were talking about chest pain. So, if someone is having all those scary symptoms, then cardiac catheterization lab, if they're in the hospital already, we can potentially um, admit you to the hospital if you're in an outpatient setting. But let's say you're in a hospital and you're feeling better, but you still have that history. One of the things you have to consider is that we can run other tests to make sure that you're not at risk of having a heart attack in the future. Those other tests includes things like a stress test. You can get an EKG, an echocardiogram, an ultrasound of your heart to see how well your heart's squeezing. If there's any abnormalities in that, then our concerns is heightened once again, and we will consider doing a cardiac catheterization once again. If all of those are normal, then we will follow up in an outpatient setting, and then we may consider a cardiac catheterization. So the question is, how do we know if you're having a heart attack? Um, some of the symptoms that are associated with people who are having heart attacks, um, it includes chest pain. Chest pain in this location, the pain radiates to the shoulder, can sometimes go into the jaw. You come into the hospital when you're having those symptoms. We will run tests, including an EKG, getting troponins, um, and if those are positive with the symptoms that you're having, you're likely having a heart attack. So we will send you to the cardiac catheterization lab where we will perform that procedure to look for the blockage. If there's a blockage, then we can open it up with a stent. We will open it up with a stent. If there are several blockages or blockages in scary locations, then we will consider open heart surgery, or also known as coronary artery bypass graft or cabbage. Yeah, that's a good statement. So the question is, do you know what the age range is where heart disease becomes a real possibility? The true answer is any age, but the older age you are, the more likelihood is it that you'll have heart disease. In regards to heart attacks itself, I typically see it in people ages ranging from mid 40s and above, but I've also seen it in very young people. The youngest person I've ever seen is 22 years old. Um, yeah, 22 years old. The scariest one was a 27-year-old, uh, but those individuals also had genetics that led to them having heart disease. Uh, but if you don't start treating those risk factors that I've mentioned before, people may end up having heart disease at a younger age. Can a civilian perform CPR? And the answer is yes. There is training for it. There is, the American Heart Association has so many resources that are available to learn CPR, especially hands hands-on CPR or CPR without the rescue breaths. Hands only CPR, sorry, CPR without the rescue breaths, because some people get scared about doing CPR if they also have to do the rescue breathing, the breathing aspect also too. But American Heart Association is a good place to start to get the information about CPR and how to treat you best. You can take an ACLS class, BLS class to get more information so that you know exactly what to do, especially if you're by yourself or with somebody else. More important question: are you married? Happily, thank you, Ashley. A joke. But yeah, I think it's been a good live. And if you guys have any other questions, I'm going to give it about 1 more minute. If not, I will head off. This was a good talk about the importance of heart health, prevention, some of the things to look out for if you're having chest pain or having a heart attack, and then what to do going to the hospital, calling 911, etc. Good, smart. I appreciate that. I try my best. Any last questions anybody may have regarding the heart health and prevention? What are the fruits that are good for the heart? I like a lot of these fruits have what's called antioxidants, and antioxidants try to remove the oxidants free reaction free radicals that can damage our body over time. So things like raspberries are pretty much my favorite ones. I would say any fruit, but specifically things like raspberries, blueberries are typically my go-to because they have the antioxidants associated with it. Is it possible to prevent heart disease if it runs in the family? Yes, and that's understanding why those individuals in your families had heart disease in the first place. So if they had heart disease because they were not taking care of their bodies, eating incorrectly, smoking, it could be as simple as just doing that. But if it was heart disease due to genetics, such as familial hyperlipidemia, then you may also carry that dream gene. So it's important to make sure that you don't have it, checking your cholesterol level, and if you do, getting it treated early so that you don't have a heart attack. One of my patients who had a heart attack was 24, 25 years old, had genetic predisposition for it, but wasn't being treated, and then had a heart attack. Their mother also had a heart attack at age 26, so she started therapy and has been doing well. But awareness of risk factors is the most important thing. What causes heart disease? The risk factors includes high blood pressure, high cholesterol, diabetes, smoking, strong family history, and not following up with your medical provider on a routinely basis, at least once a year, so that you can know if you have any risk factors or if you're at risk, and if you are, you can start treating that early. Because a lot of people will have a heart attack in their 40s, 50s, 60s, but in reality, they've had uncontrolled diabetes and hypertension for a long time. And those risk factors don't just affect your heart, they can affect your brain, causing a stroke, they can affect your kidneys, causing end stage renal disease or kidney disease, needing dialysis. Can I help you? Honestly, this is the best that I can do, is providing information via discussion. You need to go and get seen by a primary medical provider, possibly a cardiologist of your own, but start with that first. Can broken heart in love cause heart disease? It can. There's actually a syndrome called broken heart syndrome. It's also known as Takotsubo cardiomyopathy or apical ballooning syndrome. So any type of stress, whether it's psychological, physical, causes the heart to actually not function appropriately. It actually looks like you're having a heart attack, but when we look for a blockage, we don't find any. It's a diagnosis of exclusion. An echocardiogram can give us some hints, but the way that it looks on an echo is also suspicious for a heart attack. So we typically have to do a heart catheterization to rule that out first. Yo, this has been my favorite live because this is the one live that people have been asking appropriate questions. So I appreciate you guys taking the time out to actually listen to all of this and answer these questions. So I appreciate you guys. Is it related to pericarditis? No, that's different. So pericarditis is inflammation of the outer layer of the heart, known as the pericardium. The most common cause is actually we don't know. It's idiopathic, so we don't know what it is. Weird idiots. Um, but also viral illnesses. A lot of people will get sick with the flu. A lot of people will get sick with a viral illness, and then a few weeks later they come in because they're getting more short of breath or having chest pain, and then we get lab test. We look at an EKG, and it shows pericarditis in it. That's different from broken heart syndrome. Francis Ngannou. I wish. He's probably a whole 4 or 5 inches taller than me, more muscular than me. I can probably last a good 5 seconds in the ring with him, though. I'll give him a Judy chop and boom, he knocks me out. But I'll leave this for just one more question. If anybody, Dr. Ketchup, you're welcome. One more question regarding the heart health and prevention, and that's it. Yeah. All right, I appreciate you guys for taking out the time to stay on this live with me for about 25 to 27 minutes. Do you get tired of learning so much? I do, but you got to keep on doing it because medicine is changing so much. So, um, actually, these lives actually help so I can understand my weak areas. And there was a couple of topics that I fumbled on, and it took me a lot longer to get that answer out. So I'm gonna take time to look into it a little bit more, a little bit better, to come back stronger. But I appreciate you guys for taking the time out to come on here. So I appreciate you guys, and I'll be back on the next live. Oh man, yeah, I'll be back on the next live. These questions are getting kind of ridiculous now, inappropriate.